Welcome to the next section of our special topics on medicinal chemistry of autonomic nervous system drugs. Now, we are finished already with the cholinergic agonist and antagonist. We have discussed the structure activity relationship, why these drugs function the way they do. This time, we will continue with drugs that act on the adrenergic or drugs that mimics your adrenergic or adrenaline neurotransmitter. So your adrenaline or the adrenergic drugs are the one that activates our sympathetic innervations. Now let's go back to the basic structure of our adrenaline or the dopamine, for example here in the figure, which are considered as catecholamine. So catechol has this nucleus of a benzene ring with 2-hydroxy or in an ortho position 1,2-dihydroxybenzene. Now we have beta-phenylethylamine. This is our synthetic drug for synthetic adrenergic drug. Now we have also dopamine, a catecholamine that is an example of a neurotransmitter that activates our adrenergic or our sympathetic innervations. Now if we can see the difference between the beta phenylethylamine and the dopamine, they have similarities with the nucleus, but they have differences in their attachments or substituents in the side of the benzene ring. So if our activator is a catecholamine, it contains a catechol, the ring with 2-hydroxy in 1,2 carbon position. Now, it has also a tail called ethylamine, which is comprised of 2 carbon, the ethyl, and on the tail of it is an amine. That's why it is called catecholamine. Now, our dopamine is a neurotransmitter that is naturally produced by the body. It has a structure of a catecholamine. And phenylethylamine is the one that mimics our adrenergic drug. So your beta phenylethylamine here has the benzene ring, has the ethyl part and the amine part, but it has no hydroxy attachment on the ring. So the difference now between our catecholamine and the non-catecholamine is the attachment on their benzene ring part. So I'm presenting you this because our adrenergic agonist drugs are categorized according to catecholamine and non-catecholamine. Here is another example of catecholamines in our body. So let's try to look for the catechol ring here for dopamine, epinephrine, and norepinephrine. So they contain the nucleus of a catechol. Now they also possess a two carbon bridge, which is the ethyl, and the last or the tail of it is the amine portion. They only differ in how they are arranged and what are their attachments in their ethyl bridge. So these are 3 naturally occurring catecholamines, which are also useful as therapeutic agents, or they also function as adrenergic agonists in the body. So look at this picture. This one is the summary of the different organ system and the events that follows if our sympathetic innervation using adrenergic agonist is being activated. So for our central nervous system, of course, there is increased drive and increased alertness. For our eyes, there will be dilation. The heart will experience increased rate, force, and thereby increasing the blood pressure. For the saliva, it will produce little saliva and more viscous one. Bronchi will also dilate, as I have mentioned the other part, and also skin. It will cause perspiration. For our fat tissue, there will be lipolysis or the breakdown of our fats, and then there will be liberation of it in our body to provide more energy. While the liver, it will form glycogenolysis and glucose release, again as a form of energy to sustain our sympathetic innervation or the fight-flight mode. For the gastrointestinal tract, there will be decreased peristalsis, an increased sphincter tone or contraction in our sphincter, and then there will be decreased blood flow. Now, on our bladder, that will be increased sphincter tone, or there will be contraction in our sphincter, and then there will be decreased movement of our detrusor muscles. Now, for the skeletal muscle, there will be more energy needed so that blood flow it can be in so that energy will be sustained, blood flow is increased, and also glycogenolysis is increased. So let's get to know more to review our knowledge on adrenergic transmission. So adrenergic is more precisely noradrenergic transmission is restricted to the sympathetic division. So they are closely related endogenous catecholamines who I have mentioned a while ago. It is the noradrenaline, your adrenaline, and dopamine. So noradrenaline acts as transmitter at postganglionic sympathetic sites, except for your sweat glands, hair follicles, and some vasodilator fibers. And also it is present in some areas of our brain. For adrenaline, it is secreted by our adrenal medulla and may have a transmitter role in our brain. Dopamine is also the major transmitter in basal ganglia, limbic system, CTZ, anterior pituitary, and limited manner in the periphery. So I have shown you here using this figure the process of our catecholamines in the body. So it starts with phenylalanine, an amino acid. In the liver, it will be converted by hydroxylase to become tyrosine, and then it will converted again by hydroxylase to become dopa. And then with the use of the carboxylase, it will become dopamine, and the dopamine inside the vesicle will be catalyzed by beta hydroxylase to become noradrenaline. And noradrenaline, if it is catalyzed by N-methyltransferase, it now becomes adrenaline. So on the basis of chemical structure, our agonist drugs are divided into two. So as I've mentioned, it's the first, the catecholamines, and the second one is the non-catecholamines. So these are again the examples under catecholamines. We have natural catecholamine, the top three, adrenaline, noradrenaline, and dopamine. And the synthetic one, the one that we synthesize from the laboratory, we have isoprenaline and dobutamine. Now, for non-catecholamine or the one that lacks dihydroxy in their benzene ring, we have synthetic ones, the ephedrine, amphetamine, phenylephrine, methoxamine, mephentermine. So these are just some of the examples. Now, adrenergic agonists can be classified also according to their mechanism of action. Your adrenergic agonism can be directly acting, indirectly acting, and mixed acting. When we say directly acting, it acts directly stimulating our adrenergic receptor. So, the one that acts directly, for example, we have epinephrine, norepinephrine, and isoproterenol. For indirect acting, they act as agonists for our sympathetic innervation by releasing noradrenaline from adrenergic nerve endings. Example for these are drugs that contains amphetamine. Now, mixed acting is just combination of both our direct and indirect drugs. Direct and indirect pathway. And the drug for example for this is ephedrine. And the third way to classify our adrenergic drug is using their therapeutic classification. So we have here different pharmacological action and clinical use of our adrenergic drug with their different examples. They can be used as pressor agent, cardiac stimulant, bronchodilator, nasal decongestant, anorectics, and uterine relaxant vasodilators. So we have also we have also used our adrenergic drug for allergic reactions and for local vasoconstrictor. Now, to recap, our adrenergic agonist drugs mimics our natural catecholamines in the body by following or by making a structure that is almost the same with our catecholamines. It follows or it contains catechol ring, it contains ethylene bridge, and it contains amine tail. So for their action to be considered as adrenergic agonism, they must contain the benzene ring, the ethylene bridge, and the amine tail. So that would be all for agonism on adrenergic receptor. Thank you so much for listening.